My name is Katherine Glen Foster. I'm a lawyer. I'm president and CEO of Americans United for Life. We are a nonpartisan, a secular, nonprofit organization working to advance protections for all. I've been working on the legal and human aspects of this issue for close to a decade now, but I'm here because of my friends, because of people that I care about, people who have been pressured towards death. States have the power to protect the most vulnerable among us, people like elder adults, people like those living with disabilities, and most already do. Almost every state has a provision in place to help to prevent you or me from helping someone else to kill themselves. And that's even true in those states that have legalized medically induced suicide. They just decided to make an exception for one particular profession, and that's for a good reason. So often we're told that the reason why governments, why lawmakers, legislatures pass these laws, why people may consider government-endorsed suicide, assisted suicide, is either pain or fear of pain. And simply put, it's not. In the last 15 years, pain has not been in the top 5 reasons why people have sought assisted suicide in Oregon. Fear of pain has not been in the top 5 reasons. So why? Let's look to Oregon and Washington, both early states to risk legalizing assisted suicide. And when we look at their data, we see that the reasons are depression, hopelessness, fear of loss of autonomy and control. A prominent bioethicist wrote, "In this light, assisted suicide looks less like a good death in the face of unremitting pain and more like plain old suicide, which is something we all work to prevent." Yet even the mental health so-called safeguard in this bill before us does not require treatment. It's just a one-time evaluation to determine competence to consent. And in Oregon in 2018, we saw that only 3 of the 168 patients who sought assisted suicide were ever referred for a psychiatric evaluation. Dr. Kevin Fitzpatrick, who himself was paraplegic and died of cancer, said, "When non-disabled people say they despair of their future, suicide prevention is the default service we must provide. Disabled people, by contrast, feel the seductive, easy arm of the few supposedly trusted medical professionals around their shoulder. Someone who says, 'Well, you've done enough. No one could blame you.'" Rhode Island should continue to protect the lives of all of its citizens, preserve human life, prevent suicide, and study, identify, and treat its causes. End isolation for all of us. Build the bridges that make a difference. Thank you.